Hi, this is Dr. Bruce Rippey from Bridge Integrative Medicine. Yes, we are open. Thank you, by the way, all of those people who are personal messaging me, who are asking me on Facebook because of Tuesday Nights with Dr. Bruce. They're asking me, hey, are you guys still around? Yes, we're still open. We are an essential business. We're here for your health and wellness. And certainly if we can answer any questions for you, we want to. And that's what this video is about. This is about answering questions, So I did get a question. Is this COVID virus a virus? Yes, it is. So here's the thing. They're calling this COVID-19 because it's supposedly a novel virus, but people are still confused. That's the name of the disease. It's not caused by a bacteria. What's the difference? A virus lives inside of a cell and replicates inside of a cell. It needs a cell to do that. A bacteria can grow on a surface, okay? That's just the difference. By the way, a virus can grow inside of a bacteria, just so you know. Viruses are really small. This is the actual disease process. This is what we would name the virus itself. So it's SARS, sudden acute respiratory syndrome, CoV, coronavirus 2, okay? So people are confused. They say, well, what's this? This is the actual virus. This is what it causes, okay? So it is not a bacteria, it is a virus. Viruses do not live well on surfaces. So if you wipe something down, you've very likely killed it. We do a lot of that at Bridge, you know that. If you come in here and it smells like Lysol, that's why, okay? So we keep it very clean. Here again, this is really important for you to share, like, comment. It's really important that you do this because I keep things real, I keep them calm, they're all based on science. I'm not a fear monger at all, and if there is fear mongering going on, okay, but I'm glad that you're taking this seriously because you really should be, okay? Symptoms. The very first symptom you're likely to get is tired. But the problem is everybody gets tired. You don't know what it is, right? The next symptom you're likely to get is sinuses. Well, guess what? I'm not a great writer, but sinuses, okay? Here's one of the problems. It's March, almost April actually, right? Everybody right now has some allergy, very likely, and so you're going to get some of these anyway. Allergies make you tired. Allergies make your sinuses weird. So what you want to be careful of is not jump here, and I'm going to talk about that in just a minute. You probably just have allergies. Be aware of it, okay? What you're then going to get eventually, or could get, is a cough. The problem with cough, maybe I can do that better. The problem with cough is that you also get those with allergies, right? Especially at night. So if you're waking up in the morning and you have a cough, I get it. That's probably nothing. I hate to tell you, but it probably not, or it's an allergy and you're going to be fine eventually, right? When all the pollen goes away. If it's persistent, well, it just doesn't seem to end, right? If it's happening all day, every day, then that's something you want to look at, especially if it's tied into these other symptoms. That's much more important that you have these other symptoms too. Just a cough, it's not very likely, okay? Then you got to look at a temperature. So I'm going to put this up here. This is when that starts to become interesting. 101 is not an interesting temperature. You're very likely to get over it, but everybody starts looking at temperature at 102, and then you go to the hospital and so forth like that at about 103. This is when you make the phone call though. Hey doc, I'm curious, okay? I have a problem and I want to talk to you. And yes, you can talk to us. We are a medical clinic too, folks. We have nurse practitioners on staff, medical oversight, that's what we're here for, okay? You can ask us questions and we'll help, but stay in your car, we'll come to you, all right? Here's the actions. This is really what happens in all of this. This is what happens. Eventually, this becomes extreme fatigue. Tired is very different than fatigue. Fatigue is more crushing, and you'll know what I mean if you've ever had fatigue. It's very crushing. It's not, hey, I'm tired at the end of the day. It's, I have this crushing fatigue, and it really is something. At times of day where you would not normally be that way, right? At 11 o'clock at night, I have fatigue, right? But that's different, okay? That will lead to some kind of fatigue. At this point in time, we got to do something, okay? So, action steps. Let's say you have all of this. The first thing that you want to think of is I've got the 102-degree fever, fatigue, sinuses, cough. I've been tired. The action step is call someone. This is what they're going to tell you to do. Very likely, they're going to tell you stay home and be okay, right? If you are immunocompromised, that's a different situation, all right? You can call us anytime 454-5433 if you're local will help you, okay? That's really important. What else can you do? Well, what I would suggest you do is everything that you do normally. Normal self-help. So the normal self-help is going to be vitamin C, water, right? This is water, let's see, sleep, so on, right? By the way, I like zinc with this. Zinc has the tendency to kill viruses. Viruses can't get through zinc to get inside your cells and replicate. It seems to break up the process. Really works well, okay? So anything that you would do, and your multivitamin is something you should be doing anyway. Prevention, we've already done a thing on prevention. By the way, this is extremely good. We're very excited about this, and I'm going to show you, please, at the end of this video, when you get a chance to, look up the link we're going to put to it. And then if you're interested, you need to call us. This is real. We've been very excited about what we're doing right now with exosomes and regenerative medicine. But this is what you would do next, okay, when you get this. The next thing that you do is get calm. On purpose, don't read Dr. Google, okay? Dr. Google is a horrible reference at this case. You have people trying to sell their own books. You have people that have their own agenda out there. This is not useful to you. You want to get calm and be loving and kind, okay? That's going to be the important thing. And then honestly, once you've called someone, they're going to direct you through what they think you can and can't do. You will then at that point in time start telling your friends, hey, I just want to be careful here. I want to make sure that I'm okay. It's unlikely that you will have the virus. If you do have the virus, it's unlikely that you will have a lot of symptoms. If you do have symptoms, it's unlikely that you'll need to go to the hospital. All that's true. It just keeps us from overwhelming the hospital when you need to do that. If you are immunocompromised, we have a different conversation, and that's why this is your first step, because they're going to ask you questions, okay? What medications are you on? Are immunocompromised in some way, right? And we do have people that are at risk and above risk that come see us. They do this because this is extremely helpful, okay? Fear. Here's the problem with fear. Really quickly, I don't want to go through it too much, but you have an amygdala. This basically sets off the explosion. This goes to the hypothalamus and everywhere else, but here too, it goes to the hypothalamus. This all happens in your brain. And then eventually it gets to what we call adrenaline and cortisol. The unfortunate thing is that there are a couple of systems in your body that are expensive. They require a lot of time. One is the breakdown of food. So to process food is going to decrease, right? That doesn't mean you get to lose weight. What that actually means is that you're going to have intestinal symptoms, okay? You literally can poop your pants, folks. I mean, because of fear. No kidding. It can cause your body to do that, right? But unfortunately, food gets irregular. It causes problems, right? The other thing is, once you start looking at this, obviously there are other hormones and enzymes that go completely away. So thoughts decrease. Your cognitive ability, you're trying to run away. You don't care, you don't have to think, right? Sex drive, we talk about this. The reason why we talk about this, we all ride this rock together, folks. We do. We're all in this together. This would be a bit optimistic if you're being chased by a lion, okay? So if you're being chased by a lion, this is probably not on your mind, and it does change, all of that kind of stuff, okay? And then once you've got into this hard enough and far enough, you're going to notice changes in heart, changes in lungs. Let's do the old lungs. I don't know. Can we get lungs? I don't know. Right. Changes in heart, changes in lungs. All of that stuff is going to change. Well, guess what? You don't want a lot of changes in heart and lungs when you're dealing with something up here, do you? Right? So I consider it to be something very important that this is probably the best part of that message right after that. Call someone. Get calm and let's talk about this. You also lose one other thing. Guess what's one really expensive system? It takes a lot of energy from your body. Your immune system is expensive. It takes a lot of energy, a lot of time, a lot of effort from your body to constantly run this, okay? There's T cells, there's B cells, there's phagocytes, there's your white blood cells and all their systems, right? All of that takes a lot of time and energy. If you're in a state of this, you lower that. That's not the time to do that, okay? So, a couple of things, action steps. One, please share this with people. It's just real science. It's just physiology, folks. This is not all that difficult. Share it. Let people know that there's real science behind this. Let them know, call somebody and get calm. That's really the best thing you can do, right? Running around panicking is a really bad idea, especially because it lowers that. You don't want to lower your immune system. Also, this has been fabulous. We're really excited about it. So if you can, I would have you please call. You can also go to our website, which is bridgeintegrativemedicine.com, fill out a form, and we'll call you and talk with you. I think that's also a great way to do that. If you have any questions, this is a great place to put them. And thank you for your questions. I really do appreciate it. I'll be speaking about this again Tuesday nights with Dr. Bruce.